Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni. Let's look at today's top medical news. Misdiagnosed chronic disease can lead to long-term harm to physical and mental health, study reveals. A chasm of misunderstanding and miscommunication is often experienced between clinicians and patients, leading to autoimmune diseases such as lupus and vasculitis being wrongly diagnosed as psychiatric or psychosomatic conditions with a profound and lasting impact on patients, researchers have found. A study involving over 3,000 participants, both patients and clinicians, found that these misdiagnoses, sometimes termed in your head by patients, were often associated with long-term impacts on patients' physical health and well-being and damaged trust in healthcare services. Dr. Melanie Solin from the University of Cambridge led a study exploring patient-reported experiences from two large groups, each of over 1,500 patients, and in-depth interviews with 67 patients and 50 clinicians. The results are published in Rheumatology. Patients who reported that their autoimmune disease was misdiagnosed as psychosomatic or a mental health condition were more likely to experience higher levels of depression and anxiety and lower mental well-being. Omalizumab outshines oral immunotherapy in multi-foot allergy treatment. A clinical trial had found that the medication Omalizumab, marketed at Xolair, treated multi-foot allergy more effectively than oral immunotherapy in people with allergic reactions to very small amount of common foot allergens. OIT, the most common approach to treating foot allergy, involves eating gradually increasing doses of a foot allergen to reduce the allergic response to it. The findings were published in an online supplement to the Journal of Allergy and Clinical Immunology and presented at the 2025 American Academy of Allergy, Asthma, Immunology or World Allergy Organization Joint Congress. The study team enrolled 177 children and adolescents aged 1 to 17 years and 3 adults aged 18 to 55 years, all with confirmed allergy to less than half a peanut and similarly small amounts of at least 2 other common foods among milk, egg, cashew, wheat, hazelnut or walnut. After completing the first stage of the trial, 117 individuals entered the second stage of the trial. Early CPAP treatment may lower Parkinson's risk in sleep apnea patients. People with obstructive sleep apnea have an increased risk of Parkinson's disease, but if started early enough, continuous positive airway pressure may reduce that risk, according to a preliminary study released recently that will be presented at the American Academy of Neurology 77th annual meeting. The study found using CPAP within 2 years of sleep apnea diagnosis reduced the risk of Parkinson's. Obstructive sleep apnea is common, and previous research has found when untreated, it is associated with an increased risk of heart attack and stroke, said study author Gregory D. Scott, MD, PhD of the VA Portland Healthcare System in Oregon. While our study found an increased risk of Parkinson's disease, the good news is people can do something about it by using CPAP as soon as they are diagnosed with the sleep disorder. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.